Hello and welcome to another video in Foundations of Maternal and Newborn Health. In today's video, we're going to be talking about preeclampsia and eclampsia. Preeclampsia slash eclampsia. And specifically, we're going to be talking about the mechanism of disease, or how preeclampsia or eclampsia occurs, or why it happens in the body. And so first and foremost, eclampsia and preeclampsia is a disease of the placenta. Disease of placenta. And so that's why we have this image here. So this over here is kind of a zoomed up image of the placenta. And so what happens is that the placenta actually starts making proteins that signal to the mom and to the baby as well. So these are proteins, and it doesn't matter what these specific proteins are, the names of these proteins, but they cause something known as vasoconstriction. Vasoconstriction. And vasoconstriction is just narrowing of vessels. So narrowing blood vessels. And so you can think of blood vessels as actually being able to open or close, or get bigger or smaller. I shouldn't say close, because they never get completely shut, or they shouldn't anyways. But normally, if you were to kind of cut a blood vessel, it might look something like this. But the blood vessel can actually get narrower. So the blood vessel can get smaller, and this would be vasoconstriction. Blood vessel can also get larger as well. And so this would be vasodilation. We won't talk as much about that, but this vessel constricting is known as vasoconstriction. And so you can somewhat imagine if you had a hose or a faucet on your sink, and you try to make the opening of the hole with water coming out smaller by maybe sticking your thumb into it or blocking it somehow, it would actually cause the water to shoot out. And so what you're doing is increasing the pressure of the water coming out of your hose or your faucet. And so vasoconstriction is doing the same thing, but for your blood vessels, for the blood in your body that's moving around. And so vasoconstriction actually increases your blood pressure. Blood pressure. And so with excessive vasoconstriction all over your body, you can actually get hypertension or excessive high blood pressure. And so this hypertension is actually what leads to most of the side effects that are associated with preeclampsia or eclampsia. So that includes things like seizures, strokes, kidney damage, damage to your eyes. And so we'll talk in another video a little bit more about these side effects and lab tests that you can run to identify eclampsia or preeclampsia, and how they come about based on this hypertension. But most of the side effects from preeclampsia or eclampsia are caused by this hypertension, or this excessively high blood pressure that is brought on by this vasoconstriction. That again is being signaled, or your body is being told, and the placenta and the mom's blood vessels are all being told to vasoconstrict by proteins secreted by the placenta. So this vasoconstriction is also happening in the placenta, so it's happening all over the mom's body to cause this increase in blood pressure, but the vasoconstriction is also happening in the baby's vessels, basically in the vessels of the placenta on the baby's side. And so this causes what's known as placental insufficiency. So placental insufficiency. And so this causes a lot of the side effects to the baby, like intrauterine growth restriction. It can even lead to things like preterm labor. But there are other reasons why you'd have a preterm birth in eclampsia or preeclampsia. Okay, so what are the treatments then for preeclampsia? So unfortunately, there's really only one treatment for eclampsia, and we've already discussed that preeclampsia or eclampsia is a disease of the placenta, and so the only way to really treat or to really cure preeclampsia is to deliver the placenta. Deliver placenta. So you have to get rid of the placenta. And so even if you actually deliver the baby, but you leave in the placenta in some sort of hypothetical situation, an imaginary situation, the woman, the mother would still have issues of eclampsia and preeclampsia because these proteins are still being produced by the placenta. So this is really the only cure for preeclampsia or eclampsia, but there are ways that you can manage preeclampsia. So management. And so a lot of the management is just treating these symptoms or trying to protect from these symptoms. So anticonvulsants. So convulsions are seizures, and anti, of course, means to treat or to get rid of. So this would be to treat seizures, anticonvulsants, antihypertensives. And again, hypertension is high blood pressure, so treating anti-hypertension. So medications that can lower your blood pressure. And then you could also give steroids. And so this is to help develop the baby's lungs quicker. So this is for baby's lungs. And so this is because you may want to be considering a preterm delivery to remove this placenta to treat the eclampsia. But of course, if you have a preterm baby, giving steroids helps the baby's lungs develop. So the last thing that I wanted to mention is that we talked in a previous video about anticonvulsants and antihypertensives sometimes being teratogenic. So some are teratogenic. And if you've forgotten what teratogens are, you can go back and watch those videos on teratogens. But anticonvulsants and antihypertensives, not all, but some of them are teratogenic or known to cause birth defects. And so when you're treating a woman with preeclampsia or eclampsia, this is one thing you have to consider, is that you're giving the right anticonvulsants and the right antihypertensives if it's earlier in pregnancy. And then there's also the discussion of trade-offs between the well-being of the baby and the well-being of the mother. And so that's another consideration that has to be made. So this is a little bit outside the scope of midwifery, of course, but it's something to consider and be aware of when you're treating a woman with eclampsia or preeclampsia.